We've covered just about everything so far except for your eyes. Eyes are so important. They're the first thing that people see. And just yesterday, someone asked me, Shelly, who do I go to help me with my eyes? Well, Dr. Lopez can help you out. He's with Lopez Plastic Surgery. And eye lifts, I don't know, there's a lot of different things out there. I think something that you're probably doing a lot of these days is dealing with all these tired eyes that everybody has.
Yeah.
There's so many different procedures. What are you finding that you're doing more of?
So, first of all, skincare, right? So the person who's not ready for surgery, like Laura had spoken about earlier, you can do good skincare to get some tightening, and you can do some filling. But when it comes down to where you really have those fat pockets, where you have that puffiness that just needs to get improved, that's surgery. That's the only way of getting the improvement.
Are there two different surgeries, like an upper and a lower?
Correct. Yeah.
Okay, so you do them both at the same time?
Absolutely. It's a common procedure I do. So you can, if you've got that excess upper eyelid skin, you can take out that excess skin, you can tighten the muscle, and oftentimes you'll see this little fat pocket right in this central area, and you can take some of that fat out, and you get a nice sculpted upper eyelid.
And we were talking earlier that some of these procedures are actually covered by insurance, because if your eyes droop a little too much, you can't see.
Absolutely. So as we get older, our eyelids will always come down. Guaranteed, it'll happen to all of us, even you, right?
Okay. I know. It's good that we know plastic surgery.
You've got a few decades.
I have a couple of years to go.
So.
But when you see these pictures, you'll know how easy it is, and the recovery time isn't too bad. We'll take a look at our first patient over here. She had the upper eye lift, and it's almost a different woman. Right,
exactly. So you can see that it's just a significant amount of excess upper eyelid skin that you can remove, tighten the eyelids. Now here's a patient, for instance, we talk about the insurance aspect, where her eyelids are so bad it's going to affect her peripheral vision.
Right.
And by just cleaning up her upper eyelids, which will be covered by insurance, generally, again, we send it off to insurance, we do some testing, and they verify it. But for the most part, when you see that kind of upper eyelids, such as that as well, would be covered by insurance. And so you can make a significant difference aesthetically, but also functionally.
Oh my goodness,
by doing all
a
these.
Huge difference,
And it's very predictable, very reliable. Now here's a situation where you just ask, so you do them combined. Absolutely. This is a patient actually also got a lower facelift as well, but talking about the eyelids, her upper eyelids, she had that excess skin, she had those fat pockets you can see there medially near her nose, and then the kind of the puffiness or the bags, as they call them, under the eyelids.
What about, and guys too.
And guys, it happens to guys, just, it'll happen to me as well.
Look at that on the left, like he can't hardly see, his eyelids are so closed.
I know, and you can just open the eyes and get a nice contour to the upper eyelids by removing that excess eyelid skin. And he also has some tightening of the lower eyelids.
Oh, that's a big difference too.
Now, this was life-changing in terms of this this gentleman's lower eyelids. He was extremely self-conscious. Anytime he met a woman, he'd be very self-conscious about his lower eyelids. And just by removing that excess fat, tightening the skin, and this is an early result, because you can still see some redness.
He looks so much younger.
Oh my gosh, right? I mean, that's life-altering for him. He has so much more confidence.
Oh my goodness. Oh, and I'm not seeing any scars on anybody. Where are you stealing all this fat from? Where does it happen? How do you get it?
The incision is just under the eyelid margin on the lower eyelid, and it heals invisibly. And then in the upper eyelid, it's an upper eyelid crease. We'll have an upper eyelid crease that you can hide the incision in, and it's, again, invisible. Once it heals, initially it will be red. Right, it's pretty cool.
Oh my goodness. Okay, so if you come in, is this a procedure that you do in office? Do you go to the hospital for something like this?
So probably 90% of my cosmetic uppers and lower eyelids I do in the office.
Really?
And it's simply because one is a cost issue, because you don't have to pay for a facility fee or for anesthesia. And secondly, upper eyelids take me about a half an hour, and upper and lower eyelids take me about an hour, hour 15. And I can get you totally numb to where you don't feel it at all. We give you a little Valium just to calm you down, and so you're not nervous, and it's really well tolerated. And the nice thing is there's no recovery in terms of the anesthesia. So you have it done. The sutures do stay in for a week. You can get some bruising if you're a bruiser. Generally, my fair-skinned, light-eyed people tend to bruise more than those of us with more pigment. But the bruising will be gone about 7 to 10 days.
Really?
So, yeah.
So you could literally maybe take 2 weeks off of work, have something like this done, be back, and everyone just thinks you got a lot of rest.
Exactly.
I love it. Well, it is so interesting, the changes that we're able to make these days, and especially that you're able to do so many things in office without going under. And that's so important these days.
Yeah, for eyelids, it's kind of silly to be put under, especially if it's If it's a cosmetic procedure, you're paying out of pocket. Now, for the folks that are older folks who are taken care of by insurance, sometimes it's a little more comfortable to have it done in the surgery center because generally the insurance will cover for that portion.
Well, do your research. Find out what works best for you. Sit down, talk to a doctor, and we saw some, really amazing results. And of course, a lot of it is done to help you see, which is pretty important.
Yeah.
Thank you so much for coming today.
Always
we
a pleasure.
appreciate
Yeah,
it.
thanks.
Guys, if you'd like more information, you can contact Dr. Lopez. He's at Lopez Plastic Surgery on Sonterra. Go to lopezplasticsurgery.com or call ahead and schedule a consultation at 495-5771. Don't go away. Got more San Antonio Living coming your way.